Hi, my name is Marissa Warning. I'm a nursing student at the University of South Alabama, and today I will be performing a wet to dry dressing change. Before entering the patient's room, we need to check the patient's order, we need to check the hospital policy, and we also need to check make sure that we have our supplies. Once we enter the room, we will perform hand hygiene with an antiseptic scrub, and we will also check the medical records of the patient. We check the medical record to have 2 identifiers to be sure that this is our patient. We will also check the wristbands, and we see that our patient is Jaguar Jones, and he has a date of birth of August the 25th of 1963, and we also see that Mr. Jones is allergic to penicillin. Once verifying the patient, we need to inform the patient of the procedure, and then we will provide privacy by allowing a curtain to hang. We will then move on to hand hygiene. For hand hygiene, we will use soap and warm water in instances where we could run into contact with spore-forming organisms such as C. diff. We would also use it when our hands are visibly soiled, and we would use an antiseptic scrub when we are entering or exiting a patient's room, as well as when we are moving furniture or anything like that, such as trash cans, as long as they're inside the patient's room. I have already provided a video on the proper technique for hand hygiene, so I'll just move on to beginning the dressing change. Before we begin, we will move the trash can into the proper location so that we will have better access to it. We will then perform hand hygiene with an antiseptic scrub, and then we will raise the bed of the patient, lower a side rail, and position the patient so that he is comfortable. We will then put on our clean gloves. We will now put on our goggles. And we will now expose the wound. When exposing the wound, we want to make sure that we still provide Mr. Jones with privacy, but we also have enough space to work. We will now remove the tape from the previous dressing change towards the wound, and then pick up the ABD pad towards me to assess the drainage. We are looking for the type of drainage, the amount, the color, the consistency, and the odor. We will now remove the packing, being sure not to touch the edges of the wound, and we will assess the wound. We are looking for the size of the wound, we are looking for the type of the tissues, which could be granulation, necrosis, it could also be sloughing, and we would also assess the odor. We will now palpate the wound, taking note of any redness, edema, or any tenderness that the patient might note. Now we will dispose of the previous dressing change during a sterile procedure that would not fall on the ground. Okay, now we are going to set our sterile field. When setting the sterile field, we should take note of the 1-inch border that lines the field. We would place this blue side down and note that anything that is now draping is considered contaminated. We would also note that my counter is not exactly waist level, and that would also be considered contamination. However, for this procedure, it is not. We will now take and dump the contents of our basin into the middle of the sterile field to maintain sterility. We will now take the saline and assess it, we're looking for the expiration date to make sure that it's not expired, and then we will open, keeping the cap up, and pour into our basin, being sure not to splash the sterile field. And we also want to make sure that we don't contaminate the saline or the basin by touching the saline bottle to the basin. We will now recap and put away. Now we will don our sterile gloves. Okay. We will use our 2 fingers to lift this cup up. And then we're keeping the thumb away. We're going to insert the hand. Okay. And now we will take our gauze and place it into the saline. We will keep 2 dry gauze for this procedure. We will insert them one at a time. Okay, we will now assess our suture. When assessing the suture line, we are looking for the size, the approximated edges, drainage, and we're also looking for any other abnormal findings. Now we will begin to clean our suture line. To clean the suture line, you will take and wring out any leftover saline, and then you will reposition so that our sterile gloves do not touch the patient. We will clean from the middle out, as the middle is the least contaminated, and we clean from least to most contaminated. So we will clean the middle and then dispose. And we will repeat this again 2 more times, wringing out the saline, repositioning, being sure that our sterile gloves will not touch the patient. And then we will dispose. One more time. And the right side. And now we dispose. Now we will pat dry the suture line, still being sure that our sterile gloves do not touch the patient. Pat dry. And then we will dispose. Now we will begin to pack our wound. When packing the wound, you want to make sure that you wring out your gauze, but now we're going to fluff our gauze. Fluffing the gauze allows for light packing. We fluff and we insert into the wound. Then we fluff. We wring out and fluff. And we insert into the wound. And for the final one, we wring it out and we fluff. And we insert it into the wound. We will now place a dry 4x4 over the wound. And then our abdominal pad over that. And we will remove our sterile gloves. And dispose of them properly. And we will remove our goggles. Okay. We will now tape the wound. Normally, during this procedure, we would have an extra piece of tape that we put on the abdominal pad that would have our initials, the date, and the time that this was performed. This will allow the nurse that comes in after me to know who performed the procedure and what day and time. Next, we will reposition the patient. We will raise the side rail. Then we will lower the bed and provide the call button to the patient just in case they may need it. We will now clean up our supplies and dispose of them. And now we will perform hand hygiene, and then we will return to the nurse's station to document the intact suture line, the assessment of the open wound, and how our patient has tolerated this treatment or procedure.